Welcome friends. Today we will discuss fever with rash. We are discussing different cardinal manifestations of human body. Out of that, our topic of discussion was alteration in body temperature. We have divided alteration in body temperature in different parts: fever, fever with rash, fever of unknown origin, hypothermia and heat related other disorders. In last few episodes, we have discussed fever. Now, we will start discussing fever with rash. Now, in clinical practice, very often we have seen patients with fever and rash. Very often patients with fever having rash are of real challenge, but proper diagnosis of the rash with clinical syndrome sometimes point towards a particular diagnosis which helps us in interpreting the disease and giving life saving management. Now, before approaching a patient of fever with rash, we have to take proper clinical history of that patient, which is very important. Let us discuss the topics. Now, first we have to take the history of immune status of the patient, whether that patient is immunologically compromised or not. Immunologically compromised means whether any possibility of suffering from HIV or any chemotherapeutic agent for malignancy or steroid or kidney failure, hepatic failure, this type of disease, whether that patient is suffering or from or not. So, this is the basically immune status of the patient. The next one is the medications. What medications that patient is taking at least for last few months, because very often the rash may be induced by drugs, and when those medication is discontinued and when that medication started, that proper history we have to take. Specific travel history, particularly travel to an endemic zone like where rickettsia is prevalent, where different virus are predominant, that is very important. So, travel history very important for history taking in a patient having fever with rash. Immunization status, what is the immunization, what vaccines he has taken, that we have to take properly. Exposure to the domestic pets and animals, these are very important in taking history of fever with rash. Another history is dietary exposure, any recent diet, after taking a particular diet, whether patient is having fever with rash and other clinical syndromes are present or not, that is very important. Whether that patient is having any existent comorbidity like any cardiac comorbidity, that is very important in history. Whether that patient is having any prosthetic material in the body like any prosthetic valve or not, that is very important, because that is related with endocarditis, and you know endocarditis very often presents with fever and rash. And recent exposure to ill individuals and recent sexual exposure, these are two very important in taking history of a patient having fever and rash. So, if we summarize immune status, medications, specific travel history, immunization, exposure to domestic pets or other animals, recent dietary exposure, any comorbidities or cardiac abnormalities, prosthetic material, and exposure to ill individuals and sexual exposure. These are very pertinent points. We have to take proper history of these points with a checklist. After that, we have to do proper physical examination of the patient. As per our general survey and systemic examination, we will examine that patient. But as per rash concerned, we have to observe few things for concluding the type of the disease producing the rash. So, what are the points we have to see in case of rash? Number 1, types of the rash. What is the type of the rash? Number 2, configuration of the rash. Number 3, distribution of the rash. Number 4, arrangement of the rash. So, these are the points what we will try to find out. So, let us first discuss different types of the rash. Number 1, macules. Macules. What are macules? Macules are flat and colored areas in the body. This is flat. Sometimes, as for example, any blanchable erythema, these are macules. So, macules are flat and colored areas in the skin. Now, papules. What is papules? Papule means elevated from the surface. Now, what is the size? If it is less than 5 millimeter, then we will tell it is papule, and if it is more than 5 millimeter, we will tell it nodule. Sometimes nodules may have central necrosis. Now, another term is coming here is plaque. Plaque is elevated from the surface and it is flat. So, papules are solid region raised from the surface, size less than 5 millimeter, and nodules are more than 5 millimeter, that is also raised from the surface, and plaques are raised from the surface, but it is flat. So, number 1 is macule, number 2 is papule. Number 3 is wheal. What is wheal? Wheal basically are papules or plaques with different color and size, and classic wheal usually disappears in 24 hours. Now, wheals are of two types. One is classic arterial wheal, which are non-vasculitic. They usually disappear in less than 24 hours, and usually they are due to hypersensitivity reaction. Now, another is non-classic, which are arterial like wheal. They may last up to 3 to 5 days, and they are usually due to vasculitis for immune or autoimmune etiology. So, this is about wheal. So, wheals are basically papules or plaque that may be pale pink color, and in classic wheal that usually will disappear in 24 hours, less than 24 hours, and if it persists more than 24 hours, then it is non-classic and more of vasculitic in nature. Now, what are vesicles? Vesicles are less than 5 millimeter in size, and bullae is more than 5 millimeter in size. And what is that? This is circumscribed, fluid filled or fluid containing elevated lesion from the surface. So, circumscribed, fluid containing, elevated lesion from the surface is either vesicle or bullae. Now, when size is less than 5 millimeter, that is vesicle. When size is more than 5 millimeter, this is bullae. In due course of time, in some diseases like chicken pox, like herpes simplex, these vesicles may turn into pustules. So, vesicle bulla, which can be later on may develop pustular in nature, and in some diseases these vesicles may have umbilication or may not have umbilication. Now, coming to the purpura. Purpura may be of two nature, non-palpable purpura and palpable purpura. Now, what is purpura? Purpura is basically hemorrhage within the skin. Now, when hemorrhage in skin producing lesion less than 3 millimeter, we are telling that petechiae, and when it is more than 3 millimeter in size, we are telling it ecchymosis. Basically, both are hemorrhage within the skin. But in palpable purpura, where there is a dilatation of the vessel, so it is usually we are getting it in vasculitis. So, in vasculitis we are getting palpable purpura. What happens? There is inflammation of the vessel, so there is a dilatation of the vessel and with subsequent hemorrhage. So, that is known as palpable purpura. So, purpura means hemorrhage in the skin. It is of two types, non-palpable purpura, palpable purpura. Now, non-palpable purpura where the size is less than 3 millimeter means petechiae, and size is more than 3 millimeter, that is known as ecchymosis. And non-palpable purpura means bleeding within the skin. Now, in palpable purpura, we are usually getting inflamed dilated vessel with subsequent hemorrhage, which usually we are getting in vasculitis. Now, another term is ulcer. What is ulcer? Ulcer means break in the skin, at least few layers of the dermis, that is broken already. So, that is known as ulcer. And what is eschar? Eschar means a necrotic lesion covered by black crust, that is known as eschar. Eschar, you know, eschar we are getting in scrub typhus, and ulcer in different diseases we may get ulcer. So, if we summarize types of rash, that is macular, papular. Papule may be of two types, one is papule, another is nodule, and also plaques. Wheals, wheals may be of two types, classic urticaria, non-classic wheel, vesicle, bulla, and plus minus pustule, purpura, non-palpable, palpable, ulcer and eschar. So, these are different types of rashes. Now, if we think about the configuration may be annular configuration like wheel, it may be targeted configuration like erythema multiforme. So, configuration of the rash is very important in discussing different types of rashes. Now, arrangement of the rash. The arrangement of the rash may be within a particular dermatome like herpes zoster, may be diffuse whole body, may be in a particular area like acral parts, hand and foot. So, the arrangement of the lesion where it is and the distribution of the lesion, whether it is centrally placed or it is peripherally placed. That means whether it is centripetally placed or centrifugally placed. So, before discussing different types of rash, we have to understand the types of rash, configuration of the rash, arrangement of the rash and distribution of the rash. Now, depending upon this, we are classifying different types of rash. In next class, we will discuss different types of rash. Thank you very much. Please wait for the next class and join with me for classification of different types of rash in explaining fever with rash. Thank you very much.